Welcome to Coffee with Paul, where your city manager talks about topics that are important to you.
Well, welcome to another Coffee with Paul this week. And with me today, we have Bonny Specker to give us a special update on COVID, not only locally, nationally, but also across the world as well. But before we get into that, I want to give you, the people viewing this video, a quick update on where we are with COVID restrictions here in the community of Brookings, South Dakota. So right now, we do have the current ordinance, which is a mask-only ordinance in place until the end of April. Right now, the way in which the legislation was passed, City Council will take a look at the current caseloads occurring between now and April 27th to determine whether or not to go ahead and transition the current ordinance into a resolution. So right now, we do have the mask mandate in place. If we do transition into that resolution, it would be more of a recommendation. Here, most recently, the City Council did transition out the occupancy regulations and requirements within the ordinance, and therefore we only have the mask mandate, which is required in all indoor public and private businesses for people who cannot achieve 6 feet distancing. So once again, we ask everyone to abide by that ordinance and that rule until the end of April. Continue to do your part and be diligent, not only in wearing masks and understanding social distancing requirements, but also good hygiene habits. But most importantly, also getting that vaccination. Right now in our community, we have a number of pods, which is points of dispensing, mass dispensing, occurring throughout our community, and quite a bit of information can be found on our hospital's website for those individuals that are interested in signing up or learning more about these events. I encourage you to go out and find out more information there. You can also get vaccinations through many of our local pharmacies as well. So it's going to do your part so that we can continue to get back to normal as soon as possible. But to understand where we are today, I'm going to go and transition it over to Bonny Specker to help us understand what's going on with the numbers, Bonny.
Thanks, Paul. So the update I'm giving is as of today. So the state and local data are off of the Department of Health dashboard that came out earlier this morning. This is the number of cases by week in the Brookings County. And right now we've had 3,907 cases. 70 of those occurred in the last week, and there were 103 the week before. So this is, last week I had mentioned this was not looking very good, but this past week we have dropped some. So that's makes me feel pretty good, although I'm a little bit hesitant because we did have that 3-day weekend. And I want to make sure that this isn't just an artifact of problems with reporting due to the long weekend. Hopefully this is going in that direction and will keep going in that direction. One of the things I do is once a month I put up the distribution of Brookings cases by age. And I just want to show you, kind of go through this a little bit so you can understand what's happening or what this graph is showing. And let's take this 80 plus. Each of these different colored bars are different times that are about a month apart. And what you can see is that back here between October and November, we had a large increase in the number of cases in that 80 plus group. But if you look here, the last 3 months, this has been pretty flat, which is saying there's not been a lot of new cases in those older age groups. Like back here, where in the 30 to 39 year age group, between March 3rd and April 7th, we had quite a big increase in the number of cases in that age group. So you can kind of look at these graphs to see when the different ages had the biggest increases. And here, we've had the vaccinations open for this 80 plus age group longer than the younger ones. And you can kind of see that where here we have the 70 to 79 year olds have been flat the last 2 months, but there was more of an upswing back here where these had already flattened out. So another way to interpret this slide, and on these slides are all included in the slides that are presented on the city website. But one way of reading it is that as of April 7th, 8% of individuals aged 60 to 69 years of age, Brookings County residents, have tested positive for COVID. So this is the percent testing positive over time by age. If you look at the Brookings County hospitalization data, that's also dropped this past week. We've had a total hospitalizations of 143. We had 3 this past week compared to 6 the week before. So that's a good sign. And we've also not had a death for the last 2. Actually, it's been longer than that, but it's been several weeks since we've observed a death among a Brookings County resident. If you look at the South Dakota case data, we've had close to 119,000 cases, about the same this week as last week, a slight decrease this past week compared to the week before, but the state is still in substantial spread, as is Brookings County. Hospitalizations statewide, there's currently 94 people hospitalized, 17 of them are in the ICU. There have been little bit over 7,000 hospitalizations since the beginning of this pandemic for COVID. And last week we had 82 hospitalizations. That's this purple bar, new admissions, compared to 112 the week before. So that's dropped a little bit. The number currently hospitalized has dropped just a tad, and the number in the ICU is about the same. That's this yellow bar or yellow line. If you look at the deaths statewide, we've had 1,938 deaths. That dropped a lot last week. It's down to 3 compared to 11 the week before. The thing that I'm a little hesitant to say this, how great this is that the last death that has been reported on the dashboard occurred March 25th. Whether this is because there haven't been any deaths since then, or that's just a lag in the reporting of deaths, we know that that does happen, but it seems to be like a pretty long period of time. So hopefully these don't go back up because of that 3-day weekend. Vaccinations. This is showing the percent of Brookings County and South Dakota that have received at least 1 vaccine, and then also the percent that are fully vaccinated. These dotted lines are receiving at least 1 vaccine. And as I mentioned last week, these large increases that you see are the weeks that there are pods. As Paul had mentioned, the point of distribution. Those pods are vaccinating between 1,200 and 1,500 people in a day. So the number of vaccinated people in Brookings is increasing quite dramatically. And then here are the fully vaccinated. We have 20%, 37% partially vaccinated. One thing to remember is that even though this is a high percent and it is increasing, it's still telling you that there's a lot of susceptible people out there that we need to be aware of. If you look at the percent of population receiving at least 1 vaccine, and this is by for the state, I don't have it for Brookings County. You can see that the older age groups, a high percent of them have been vaccinated. It'll be really nice when this is more even straight across, because as I mentioned earlier, that 30 to 39 age group is having a lot of cases in Brookings. You know, when this gets up higher, we're going to see less cases in these other age groups. So this is the percent of South Dakota and Brookings populations that have ever tested positive by age. And you can see that Brookings County has done better in all age groups than the state in terms of the percent that have tested positive. So again, how to read this, 12.2% of South Dakotans age 60 to 69 have tested positive, compared to only 8% of Brookings County residents in that same age group. The highest age group for testing positive is the 20 to 29 year age group, followed by this 40 to 49 year age group. If you look at percent of cases ever hospitalized, so this is what percent of the people who have tested positive were actually hospitalized. You can see that there's a definite relationship with age. We have about 1% of the people less than 20 being hospitalized, going up to 28% of those 80 years and older. The case fatality rate, or the percent of the people that have been diagnosed with COVID that die from COVID, also follows a similar pattern as this, with low levels down in these younger age groups and increasing quite dramatically with age. If you look at the US, we've had 31.5 million cases, pretty much the same the last 2 weeks, around 460,000 a week. And if you look at the deaths, these have been dropping. We've had over 570,000 deaths. We had 6,000 last week compared to 7,000 the week before. So that is a good thing. Worldwide, we've had 133 million cases, and these are still continuing to go up. I think the World Health Organization is very concerned about this, because the more cases there are worldwide, the more likely you're going to get a mutation in the virus that may not be, that vaccines may not be effective against, or they may cause more severe illness. So this is of concern, this increase that they're seeing globally. But it also indicates how important it is for the world to be vaccinated, not just an individual country, but it's important worldwide. Close to 2.9 million deaths have occurred. There were 70,000 deaths worldwide last week, and about the same the week before. So these have stayed pretty much the same. So just to summarize it, the new cases and hospitalizations have declined slightly this past week in Brookings County. It's really important to be responsible and to protect yourself and your neighbors. You need to wear a mask, socially distance, wash your hands, avoid those poorly ventilated areas and crowded areas. And as Paul had mentioned, it's important to get vaccinated. Following these recommendations will really help us return to normal sooner. And I just wanted to mention that the state did open up vaccines to everyone who's older than 16 years of age. And this is the website that you can get more information on where you can do that. So if you have any questions that you'd like me to answer, just send Chelsea an email, and I'll be happy to do that next week. That's all. Thanks, Paul.
Well, thank you, Bonnie, for sharing that information for not only what's going on here in Brookings, across the state, nationally, and across the world. This type of information helps us all stay informed. But as you mentioned earlier, we all have to still continue to do our part, wear our masks, socially distance whenever possible, but just as importantly, sign up to attain a vaccination if you can. Once again, we have many of spots available at the pods, and encourage you to go out there, find out more information on our pods and available vaccinations through the Department of Health website. So until next time, thank you for joining us with another Coffee with Paul and Bonny Specker. Take care and have a wonderful day.